Good afternoon, everybody. On behalf of KPCC and LAist, welcome to this virtual event. My name is John Cohn. I manage live programming and events for KPCC and LAist. This is the second virtual event we've done as part of our No Panic Guide live series. Thank you so much for joining us. There will be more. If you want to sign up for our newsletter, you can do that. You can follow us on social for updates. Below, there will be links in our comments section that you can check out. And if you happen to be in a position in which you can support KPCC and LAist, we're grateful for anything you can do. Links to that as well in the comments section. And if you have questions for Glenn, you can enter those in the comments section. So there's a lot happening in the comment. We hope to hear from you. Without further ado, I'd like to introduce you to your host for this afternoon, our Unheard LA host, Bruce Lemon.
Hi, everybody. Welcome to my home and your home. I'm Bruce Lemon. Usually I'd be hosting Unheard LA from theaters all over Southern California, but today we are all meeting together from the comfort of our own homes for the special edition of the No Panic Guide live. And today we'll be talking to Dr. Glenn Fernandez. I first met Glenn through Unheard LA, where he talked about being an ER doc and an opera singer. Then we heard a little more about the opera singing, but today we wanted to chat more about being an ER doctor. He's been making his rounds lately and is here today to tell us about his experience in emergency rooms in the time of COVID-19. Glenn, thank you so much for joining us today.
Thank you. Thanks for having me.
Now, many of us are watching the news closely and we see what the situation is at hospitals around the world. What's it like at your hospital?
Well, things are definitely different than before. I work at several different hospitals because I'm part of this really great group of emergency physicians that covers several hospitals in Los Angeles. So over the past couple of weeks, I've been in areas like Anaheim and Whittier and Arcadia. Fortunately, right now, at least in those areas, it doesn't look like the footage you see from Italy and New York. I do know, however, from reports from my colleagues that things are starting to get very intense, even in places like Chicago, Michigan, New Orleans. So what we're doing right now is basically we're in preparation mode for a surge of cases that we're pretty sure is going to start happening. But I just want to thank everyone for taking the self-quarantine measures so seriously, because even though the evidence and the numbers are still coming back in right now, I have a feeling that it's helping. So, so things are definitely different than before.
Let's find out more about that. What's it like a day in the life of an ER doctor right now, and how is this different from before the pandemic?
For sure. So just to run through a day when I have to go on a shift, some things that are different is before I go to work, I check my email because the way this virus behaves is it's fast and it changes quickly. So I look to see any updates of cases that have developed. I look to see if there's any changes in hospital policy that we're implementing during that day, because it can change from day to day. After that, I head off to work. It depends on if it's the morning or the nighttime. The first big change you'll notice in the hospital rooms, hospital ERs that I work at, is you'll see tents outside now. These tents, even before you enter the building, are meant to help us triage patients. So what we don't want happening is for someone carrying the virus, whether they're symptomatic or not, to become a vector inside the emergency room. So the patient will be screened in the tent first, and then we'll see if it's not an emergency, maybe they can be handled without them even stepping foot into the emergency room. If they are seriously sick and are suspicious for a respiratory infection, then we can transport them into the ER in a safer manner when we know what we're dealing with. So that's a new thing. Then when you step toward the door of the hospital, not even before going inside yet, you'll get your temperature taken, which is new. If you're afebrile, you can go right in. So then I'll go into the emergency room. one of the first things I'll do is find out where I can get my mask for the day. Uh, we don't have an infinite number of these N95s, so usually someone like the charge nurse will be holding those, so we can check one out from her or him, and then you basically go about your day again. Another different thing during the shift is that we're very super aware now of which rooms are isolation rooms that have respiratory precautions, which are like negative pressure rooms, is what they're called. These are special rooms that are already designed to have a different air circulation system so that, for example, the air conditioning doesn't blow the air within that special room out into the hallway. There are a very limited number of these. Just because by designs of the hospitals. So we have to be aware of which ones those are and who we put in those because we don't have an infinite amount. The majority of the shift right now, you just try to manage the patients as you would before. The human body hasn't changed since the coronavirus infection started. So you just try to do your best practices. Like I said, the scenes at the hospitals I work at don't look like the dramatic scenes yet of New York and Italy, but I do hear some reports from my colleagues that certain hospitals in the Orange County area, some in the Los Angeles area, they are starting to see an increase, and we all expect an increase. Then when the shift is done, during the shift, I wear my mask all the time now. I don't take it off. I try not to take it off. It's tough, but I try not to. And then at the end of the shift, I decontaminate, which I usually didn't do before because I would decontaminate between each patient. But at the end of the day, I just take that extra step to make sure my badge and my stethoscope and the mask, which I may have to reuse again, I try to just clean them off as much as possible, and then do an extra decontamination, and then I go home.
Hmm. So, end of your shift after you've uh, spent this harrowing day and decontaminate. How do you then transition into some kind of rest? How do you decompress to set yourself up for the next day?
For sure. Well, I don't have a shift every single day. So on those days that I don't, I have to self quarantine just like everyone else. Um, as you were saying before, then when I met you, I'm an opera singer and an ER doctor simultaneously. And even before COVID-19, I was heavily involved in the arts, in singing and acting and things like that. And I realized very early on in the quarantine that if I didn't stay productive, then I would go a little bit crazy. So I do two things to decompress. One thing is I do drawings, which have been getting a little bit more popular, and I post them on my Facebook and my Instagram.
Oh,
They're called Little Coronavirus. It's like hashtag Little Coronavirus. It's like a cute little rendition of what the coronavirus would be if it was a little character, but I use it to disseminate information that people might need, like about recommendation about social distancing and um, updates on which states are being affected the most. But it's a nice digestible way to get this information because the character is very cute. um, and the second way that I decompress is I'm singing still. I sing every day. I started this new project called hashtag Disney Quarantine. I learn a Disney song every morning, then I record it in the afternoon, and then I post it on Facebook at night. So I'm doing a song for every day we're in quarantine, and that's
oh.
helpful to me. And some people say it's helpful to them too.
Well, we should see if we can get people to take a look at that. So if we can get your Instagram handle and your YouTube page in the comments, so people can check that out and get some more of that information and some of this uplifting music to help us through these tough times. We have some questions coming in from the world, from the internet. We have some from Facebook, and I'd like to go ahead and ask some of those questions from our audience. Sound good?
Yes.
Great. First off, we're getting a lot of questions about mask. I guess especially after the mayor just released a recommendation that we all wear cloth masks when we're doing essential acts in public. Can you speak to those recommendations and what we should know?
For sure. So let me set this up a little bit. So there are two different types of masks. One is that N95 respirator that everyone's been hearing about. This is a special type of mask where its construction can filter out particles that are small, basically the size of particles that you need to filter out if you're trying to avoid inhaling the coronavirus. So these specialized masks are definitely what's needed by people that are in direct contact and exposure to carriers of the coronavirus. So those are things that we'd want to ration toward our healthcare professionals. They're the masks that I need in the emergency room. Then there are other masks, like homemade masks and even the surgical masks that aren't directly as effective at filtering those out. However, as Mayor Garcetti from Los Angeles recommended, he thinks that it would be beneficial if the public was to wear um, just the homemade masks, the cloth masks, not the N95 mask for general use. I completely agree with this recommendation. It is true that it's not as effective as filtering out airborne particles, those small particles, but it still acts as a barrier. Coronavirus can be not only transmitted as individual particles in the air, but it can also be transmitted through droplets as well. It can also be transmitted if you put your hand on something contaminated and touch your face. So even though the regular and homemade masks aren't as perfect as the N95 mask, they do add a barrier between you and that virus. If the virus is being carried by a large droplet, a, a homemade or cloth mask or a regular mask would be able to act as an additional barrier. And then also, if you were to put your hand on something and accidentally touch your face, it can act as another physical barrier. So the CDC right now hasn't put out that recommendation for the general public to use regular masks, but I think Mayor Garcetti is wise and ahead of the curve on this one. And I would recommend that if you're able to go ahead and wear masks outside as the general public. And it doesn't have to be the N95 mask. But with that being said, the gold standard for preventing the transmission of this virus really is social distancing. Masks of any kind can't compare to the effectiveness of social distancing. That's why I'm so happy to see people taking this self quarantine very seriously. It really is right now our best known weapon against the spread of this virus. Also, washing your hands, that is with just soap and water, is way more effective than hoping a mask or a glove will stop the transmission. So first priority, the self quarantine, the social distancing. Second priority, I would say, is washing your hands, soap and water. And then, yeah, let's go ahead and add the cherry on top of using masks. There's no side effect to using a mask unless you are afraid of looking not fashionable, but it's totally worth it.
Right. Well, some people are making some really nice masks. My mom has started making homemade masks. Actually, she's outfitting the whole family now. So
Nice.
you can, right?
And actually, I know there's some questions about homemade masks and donating them to the emergency room. In one of the shifts that I was on, someone did make a bunch of homemade masks for us, just out of yeah, very fashionable cloth with prints on it, and they gave it to us. And I took one. I'm appreciative of those because even though it's not as effective as the N95 respirator mask that I use, since we have to reuse these N95 respirators at this point, I use it over that N95 respirator to try to prolong the life of it. So those donations actually do help us. Also, one doctor had an N95 mask where the straps had actually, the elastic straps had fallen off, but he was able to use a regular mask to hold it in place. It's not ideal. It's not ideal, of course, but I appreciate these efforts at home to make masks. And I think many healthcare providers would welcome your donation if you're doing that sort of thing. But don't feel that you have to make masks for us. That's not your responsibility.
a good sign to see people coming together to aid in any way. Let's jump into another question. When this is from Instagram actually, when will we know we have flattened the curve?
That's a good question. Um, well, I think what it was best said by one statistician a while ago. It's really going to take 2 weeks of self quarantine measures to see if there's an effect on this curve. We're actually reaching that 2 week period right about now. Uh, so we're getting the numbers in. However, we do have some preliminary numbers. There was a report by the federal government that they think it's helping. So that's one thing. And then another thing is I just saw an article in the New York Times where they actually use cell phone data to see which sections of the country are taking the self quarantine measures
Yeah,
seriously.
they can see how people were
Uh,
moving around still, like regular before the safer in place was put into effect.
right. And there is a correlation between the lower rate of increase of cases with the areas that instituted the self quarantine earlier, like California. We're not, like I said, we're not officially one of those hot spots yet that's getting overwhelmed. That could change tomorrow, but we instituted our self quarantine early, and uh, I think that's helping.
Great, great. Let's talk to another question from Facebook. This one is coming from Donna, and it reads, "My husband and I are considered elderly and are basically staying at home, other than walking our dog. We stay away from others. When we get home, what precautions do we need to take when we get home? I know you do a full decontamination, but how do we stay safe after a brief outing?"
Right. So first off, again, thank you for staying home, and thank you for all the other people that are staying home to help protect people that are elderly. Um, so really, if you're practicing the social distancing and you're staying at home, that really is the biggest precaution you can take. If you and your husband aren't currently showing symptoms, um, that's hopefully a sign that no one in your household is carrying the virus or is a vector. So between you two, you won't have to worry about decontaminating between each person. Basically, if you live in the same household as someone else, it's sort of futile to try to decontaminate between each person because you basically want to take each household as a as an isolation unit. The virus is spread through the air. So if you live with it's you and your husband, then you consider yourself basically a self quarantine unit. So you don't have to decontaminate in between yourselves, like in between your usage of utensils or dishes or glasses or things like that. It really is a matter of keeping you and your husband safe, protected from any outside source that might be a vector for that virus. So I think you're doing a great job from what I'm hearing from the stem of the question.
Uh, Great. Thank you for that. So we just wash our hands, don't touch our face, and follow the guidelines that are given to us. We should be as safe as possible.
Exactly. Self quarantine, social distancing, and washing your hands are the most important.
Yeah, I want you to know I've avoided touching my face for at least 17 minutes so far, and I'm very proud of myself. Let's have another.
It's hard because it's in human nature to touch your face. This is not natural. Oh, also, another thing I want to say is it's in human nature to be in contact with other human beings. So this is not a natural state for us. So I appreciate the effort everyone is going through to do all these measures. Um, but it is in human nature to band together and help out the society we live in. So let's just keep going, you guys.
Speaking of our human nature, and here's a question also from Livestream. Actually, this is from Kelly Solom, and her question is: how do you find time to sing and record when you're working?
Yeah. Okay. This is a question I get. So I don't have a shift every day. So I only do it on those days. Um, And I found that if I have empty hours in the day that aren't structured, I get anxious. So basically, what happens is in the morning, I pick the Disney song until noon. I try to learn it, um, listen to recordings, play it on my piano. Then after between noon and 4 o'clock, I grab my MacBook and I use the GarageBand to record it. And then around dinner time, I listen to it, edit it together, and then put it out on YouTube. So it's a whole day thing, but it keeps me busy. It keeps me sane. I have to sing to stay sane. But I do want to note that for some people, this extreme environment of being self quarantined, if your version of staying sane is to be less productive, that's totally okay. For some people, you need this time to relax and rest and clear away what you thought was necessary before, but is you realize now is no longer necessary. That's a totally valid way of handling the self quarantine to be less productive than usual. For some people like me, I have to be more productive or I get anxious. So just honor what you're feeling at the moment and don't feel pressured to be more or less productive. I know it sometimes seems fun and impressive that I'm outputting more music, but it's a stress reaction really. So
Sure.
just be mindful of what your body needs.
Great, great. Speaking of self care and things we need to do to protect ourselves and take care of ourselves while we're stuck inside, this is a question from Derek Sakata. I wanted to get your opinions as a medical professional on the mental toll this whole event is taking on people with mental health issues.
Okay, totally. So in the ER, we're still seeing um, those severe cases of mental health issues, for sure. Those still exist. Um, it's hard to tell whether or not it's directly exacerbated by what's going on right now. Um, I would say that just like with any other health issue, mental or uh, physical, um, if you're having issues, the first step is to call your primary care doctor or the psychologist, psychiatrist you've been working with. I know that there are some clinics that are open now, both internal medicine, family medicine, as well as psychiatric, psychological, that are open now that are doing telemedicine. So this is still a resource that's available to all of us in many cases. There are clinics out there that are still open and operating through telemedicine. So definitely take advantage of that if it's becoming an issue. Um, but yes, of course, like I was saying, this is an unusual situation for us to be in, for us to be isolated from human contact, to be um, isolated from human touch in some cases. So it's going to be stressful. So I do have some evidence-based suggestions for stress management. There are a lot of solutions floating out around there, but there's been research into this. So there are some four things that are helpful for stress management. There was a study at UC Davis, University of Miami, where they noticed that if people would make a list of things they're grateful for, like journaling what you're grateful for, that's helped with stress levels. Um, Columbia University, they did a different study with fMRI. They found that in some people was helpful if people could put a name to a negative emotion that they were feeling. Sometimes that helped people cope with that emotion. Another study from Swarthmore College showed that making a good enough plan help decrease stress levels sometimes. So that means if you're anxious about what you need to do next in your day, writing down or at least mentally clearly stating just a plan that you think is good enough and not perfect, that helps decrease stress levels. Unfortunately, one of the studies that I came across that was a suggestion for decreasing anxiety was human touch, which which we can't all do right now. Our touch is limited. So I only mention that study just to let you guys know that this is an unusual situation. It's not forever, it's only temporary. So continue to power through because this virus is very serious.
Oh, okay. So let's keep going. That this is a question from the live stream from David in the live stream. How do my significant other and I interact safely if we live in different houses or cities
Oh,
and
goodness.
together since 3-9? My gut suggests we have to stay apart until all clear, which is crazy. So if we need that touch, we can't have it. What do you think? How do
It's
we?
hard. There really is no good answer for this. I mean, if I was speaking from a purely scientific point of view, yeah, I would prefer that people limit their interaction, their physical interaction to continue social distancing. Thank goodness it's not the 80s, the 90s, where we didn't even have FaceTime. We didn't have Google Hangout. Now at least we're able to intellectually be close to each other through this technology. um, so try to use that as much as you can. But yes, if you are within 6 feet of one another, even if it is your significant other, you have the possibility of transmitting the virus. You know, you if you're young, you may not uh, suffer very much from the virus. You may not even feel symptoms, but the problem is that down the line, someone who's carrying the virus that is young and healthy and asymptomatic might transport it to someone who will die because of this virus. So, but I understand this is difficult. There's not a great answer for you, but it would be wonderful if you could continue to social distance.
Thank you for that hard medicine. It's tough, but we all are in this together. Here's another question from the Facebook Live thread from Irene Gesso. If we do go out in public, do we have to remove all clothing and take a shower and wash our hair when we get home?
Okay, this is a good one too. Um, so if you're practicing social distancing 6 feet apart, the chance of you carrying enough any viral load or enough of a viral load to cause a problem is highly unlikely. So if you are not within 6 feet of someone while you're out and about, you don't have to decontaminate really. The chances of you causing an issue by not decontaminating is not likely. However, if someone in your house is immune compromised or older, one of these high risk groups, um, you can take that extra step to decontaminate if you would like. But most of the general public, if you maintain the social distancing, you don't have to do daily decontamination of your clothes and your hair.
Good to know. Good to know. Thank you. Thank you. Thank you so much, Glenn. You've answered a lot of questions. There are a lot more questions.
Mhm.
But we have them, and hopefully people can communicate with each other as well and see if we can all pass around the correct information so that we all know what's going on. Thank you for being here. Thank you for doing what you're doing. Thank you everyone for joining us for this conversation. This is going to be up posted so you can review it and take it in. And be sure you check out Glenn's Instagram for some doodles with more information that's important for you to know. And check in for a Disney song to lighten your day a little bit. Thank you so much, Glenn. Is there anything else you
Thank you.
want to say to anyone before you go, or?
Oh, actually, yes. So, yeah, I would just thank you everyone for doing the self quarantine. Thank you for doing the social distancing. This virus is there is question as to whether or not this is a serious issue or not, as to whether or not we're panicking or not. I just want to answer that question. Yes, this virus is serious. It's deadly. And I'm glad we're doing all these precautions. I'm glad we are taking it to this level of caution. So please continue to do that and try to let other people know that they should be doing that too.
Great, great. We'll do. We'll do. Everybody, for any questions that we didn't get to here in this session, we will do our very best to find answers and follow up with you after this broadcast. So thank you so much. Be safe. stay home, wash your hands, don't touch your face. I found my song to wash my hands to. It's Juvenile's Back That Thing Up. What are you singing when you wash your hands, Glenn?
I guess it's whatever Disney song is of the day.
Fantastic. Go ahead and check that link so you can get some inspiration, everybody. Thank you so much. We're in this together. Be safe.